Hi, everyone. I'm excited to be on this platform here on YouTube. So, we are going to get into RF microneedling. We do a lot of microneedling at ABRAZA Skin Studio at both locations, actually. We do a lot of microneedlings here at the Atlanta location. That's where I'm located. And also in downtown Silver Spring. So check us out in those two cities, abrazaskinstudio.com. My name is Dr. Natasha Welch. I am a nurse practitioner, and I started this whole thing here with ABRAZA Skin Studio. And again, we're a med spa. We specialize in medical aesthetics. One of our most popular procedures is RF microneedling, and that's what I'm going to get into tonight. Now, you have regular microneedling. I'm just going to call it regular. It is still profound results, so I'm not diminishing the outcomes of the procedure. But when we put the two next to each other, the big gun is definitely RF microneedling. Now, I don't have a machine with me because I'm here at home, but if you have skin that has never had any rejuvenation done, so hey, you've had no skin rejuvenation done. If you've had, and when I say that, like, hey, I haven't had a facial, I haven't had a mic, I haven't had anything. If you're hitting that big 4-0 or big 5-0 or whatever is the big number coming up, and you feel like you need to turn the clock back a little, RF microneedling is almost equivalent to doing two of the other microneedling in one procedure. So people get a little sticker shock when they see the prices. However, it's almost like 2 in 1. That's how much collagen induction you get from it. So let's go back one. RF microneedling is a form of collagen induction. It is a procedure that will bring more collagen up to the surface, and therefore you will smooth lines, wrinkles. If you have scarring on your skin, especially any texture scarrings like cuts in or acne scars, I don't know why I'm drawing a blank, but the acne scarring on the skin, any of the pitting scars or box scars, those type of things, this is what you need. And I'm going to say this especially for skin of color because I'm very funny about different lasers to help with collagen induction on melanated skin. And that is just because of the up the road what you may find done to the melanosomes, which are your cells that produce your melanin or your color. And what can happen is people can have damage, thermal damage, and that's usually manifested by hyperpigmentation or dark marks in the skin. So we never want that up the road. Sometimes you have the procedure now, then later you're seeing melasma and all these changes. So that's me. I am not a fan. I believe you can bring collagen up and smooth the skin with different type of microneedling devices that are safe for skin of color. Now, this procedure can be done on any skin, okay? However, it's always proceed with caution with melanated skin because you never want to leave any damage. All right, so this is an RF needle head. I'm just showing you an example of what we use to do the procedure. Now, this attaches to a handle, to a handpiece. However, if you could really get in there, you will see those gold things in there? Those are needles, okay? And the machine will push this, which will deploy those needles out, okay? And I wish I can push it out, but I guess I'm not that strong, or however this mechanism is, you can't do it manually. However, we have different size needle heads that some are bigger for body parts. This is a nice small one, so it gets in close to the eye, okay? And each time we apply to the skin, it kind of sucks onto the skin, and the machine will deploy those needles into your skin. Now, we measure with the machine on this, a panel on the machine, and we can tell the machine how deep we want the needles to go. We can also control the thermal heat. So RF, radio frequency heat, comes off of these 14 karat gold plated needles. The only reason why they're 14 karat gold plated is because they conduct heat better. Okay. Um, it's not like, oh, it's better because it's gold. No, it's just that it conducts heat better because it's gold. Now, once the needles get into the skin, and we never want to go deeper than the dermis. We never want to go. So if someone's doing this and the person is extremely bloody, they went too deep. Because what I don't want is these heated needles to hit your subcutaneous tissue and destroy structures in the skin, which can give you more sag. Okay, so you got to be careful. That's why you got to go to a provider that knows what they're doing. So different parts of the face, we want to hit it with different needle depths. I typically go all over the face and we kind of cross over the last place we stamped. Okay, so they're very tight and close. All right. And then once we're done, we come through with another pass where we bring the needles up a little bit higher in the skin, up towards the surface. Okay. Then we do another round. And then we do one more with a needle depth much more superficial. Okay. So it's 3 passes. Now, what is so cool is your regular microneedling hits collagen. These heated needles cause more elastin to come to surface. So elastin is responsible for tightening and lift. So with RF microneedling, you're getting like a 2-for-1. You're getting the collagen induction to smooth the lines, wrinkles, get the texture smoother, but you're also getting some degree of tightening. Who is this for ideally? Women starting to hit 40, 50, 60, start to see this come a little bit. You can tighten that up with RF microneedling. Okay, so it is safe to go on the skin. It's not going penetrating the thyroid or anything like that. It's just going skin depth. Okay, skin deep, and it's great for tightening. Excellent. Okay, your areas where you get Botox, you want RF, give you more lift and tightening. So we are turning back the clock. And what's so beautiful is that you can do RF with different types of serums. Now we have brightening serum, hyaluronic acid. Brightening means is delivering brightening products into the dermis, to where a lot down there deeper in the skin is where a lot of the hyperpigmentation damages. So we can go down there and help bring up some of these dark spots. So we can use also hyaluronic acid. Now the brightening serum also has a hyaluronic acid base, okay? Or plain hyaluronic acid. Another option we do is exosomes, which are actually human derived stem cell cytokines. So, and they're coming from umbilical cord. Why? The cells turn over faster and heal faster when we were in utero or in the uterus. And that's why they get it from umbilical cords. Yes, these things are tested, cleaned, and all that stuff. Now, more profound results, because now that's a form of like a stem cell, so to speak, right? Next is you can use your own stem cells, which we draw your blood, and that's called platelet-rich plasma. We spin it in a centrifuge, separate the plasma from the red blood cells. So the red part is separated, and the clear part, which is your plasma, that yellow part that we called the pus when we were kids, is full of your platelets and your body's own stem cells, and we can microneedle that into the skin with RF microneedling. Thank you, growth serums. Jeez, please help me. But nonetheless, you can do RF with so many different agents in the skin. But I love RF microneedling. We do a lot of it, okay? But people, again, get sticker shock. Don't be sticker shock. It's like 2 of the regular microneedling in 1 procedure. But definitely watch who you go to. I have corrected people's RF microneedling. I don't even care what machine it is. My big thing is whoever's operating the machine should know how much heat to use, when to pull those needles back on different parts of the face or body. Because again, we don't want this heat to go down to subcutaneous tissue, which is your fat, or going down to, we're not going to muscle, but it will be your subcutaneous tissue. We don't want to destroy that stuff. We don't want to put heat in there. So we want to be careful about it. So make sure you pick a provider who really knows what they're doing. Okay. That's about it. I don't have much else for you. I think, hey, if you haven't had an RF microneedling, you need to go get one. And like I said, I tell people who are calling them by machine names and that's cool. The biggest thing you need to know is who's operating that machine and are they skilled at it, okay? And what's their heat settings? Is it safe, especially if it's skin of color? Because you can burn someone with RF microneedling. You definitely can burn someone. So you gotta be careful, okay? But yeah, people always ask, should I get 2 or 3? I'm a person to person dependent, because sometimes if that outcome looks really good, I like to bring clients back in about 2 to 4 weeks, 4 weeks the max, but 2-3 weeks, bring them back, get a facial. And so I can observe the skin and I can tell, like, I don't really like 2 weeks. If you really want to tell, 4 to 6 weeks is when you really start seeing things. To me, 8 weeks is your best you're going to look. You're going to look good anyway in about 14 days, but it just keeps improving up to 8 weeks. Now, results are permanent. The only thing we can't stop is father time. So you're going to continue to lose collagen. If you're over age 40, definitely every year you're going to lose collagen. But remember that a microneedling session will restore a lot of that collagen that got lost over the past 12 months. And that's why I tell people, depending on how aggressive you want to be with your anti-aging regimen, but a microneedling should be done 6 to 9 months. RF doesn't have to. I got RF, I think, a year ago, and now I'm going to do regular microneedling. So I don't have to do RF. I don't have to get that aggressive unless I want to do tightening. So mine, I did more specific. I'm 51 years old. I'm starting to see, like, hey, wait a minute, what happened to that square jawline? So I like to do it to get some tightening, okay? But I don't do it often because there's no need to. I'm happy with my skin, and regular microneedling resets the clock for me all the time. Okay. And of course, great skincare products. Now, another thing we do is we couple product with procedure. So for our our brightening microneedling, even with RF, they take home the dark spot serum by ABRAZA Skincare. If they're getting the hyaluronic acid microneedle, they take home a bottle of the Radiant Moisture hyaluronic acid with the procedure. Okay. Oh, for the chin area, look, I'm here for all of it. Oh, another thing, our machine, and I think some machines do have it. We have one where, and I did it last month with Diamond members. Okay. They get a little extra razzle dazzle every month. I try to, but I did RF, just plain RF. So if you have a plain RF probe, that's nice too to use around here, just so you know. Yeah. Yeah. So we have it. It tingles. It doesn't hurt, but you definitely do see, the effects. But that's pretty much about it. Another thing I'll tell you too, what's good for tightening. People sleep on it, microcurrent. I'm a microcurrent fan. It works. That lift, even though you're not going to get to tightening per se, but at least if you can get lift. And that's what I like about doing microcurrent. My new thing is, like, every 3rd month I go on aggressive or microcurrent. But we're about to sell a microcurrent. That's going to be a whole nother thing. Yes. But anyway, thanks for joining. I don't like to take up too much of people's attention span, so I like to keep it under 15 minutes if I can. But bye. Have a great evening. Take care, everybody.